The third element under group 2A, alkaline earth metals, is calcium. This is the second most abundant cation in the extracellular fluid. Tandaan lang ulit yung mnemonics natin for the second major cations in the cellular fluids. Mnemonics is MICO. Yung CO dyan, that stands for calcium out. So, ibig sabihin, si calcium siya yung second major abundant cation in the extracellular fluid. So, outside of the cell. And recall as well that the ion of this metal, the calcium ion, is a contributor to the water hardness. Naalala, together with magnesium ion, these ions contributes to the hardness of water. Also, calcium is an important component of hydroxyapatite. Hydroxyapatite is chemically known as pentacalcium hydroxide triphosphate. Okay, again, pentacalcium hydroxide triphosphate, that is the chemical name of hydroxyapatite. This is a mineral that makes up the bone, it makes up the matrix of the teeth. In fact, this is the mineral that gives the bones in the teeth its rigid characteristics. Okay, so ito yung reason bakit very rigid yung property ng bones tsaka teeth. That is why calcium ion, very essential element gid siya. Kasi nga, primary element siya ng bones tsaka teeth. Now, for the maximum absorption of calcium ion in the body, for the maximum utilization of calcium ion in the body, vitamin D is very much needed. Okay? Again, very important for the physiological utilization of calcium ion, yung vitamin D. Okay? Ayan, vitamin D. So, ibig sabihin, synergistic yung effect nila. Okay? Synergistic yung effect. So, somehow, may idea na kayo what the synergistic means. Diba? Synergistic effect. Ibig sabihin, presence ng isang substance could enhance or improve the absorption or the effect of the substance or ion of interest. So for this example, si calcium ion na-enhance yung effect niya in the body in the presence of vitamin D. Diba, vitamin D, this is known as the sunshine vitamin. But it doesn't mean na sunshine vitamin siya, makukuha natin yung vitamin through sunlight. Hindi po. Yung vitamin D, we already have that in our body. It only has to be activated. Okay? So, yung vitamin D, napoproduce yan sa body natin in response to our skin being exposed to sunlight. So, kailangan lang siyang ma-activate via exposing our body, our skin, uh, underneath sunlight. That is why very important din na ma-expose tayo lightly sa sun. That is very good for our skin. Also for the greater activation ng vitamin D sa body natin, which is very important for the enhancement, physiological absorption ng calcium ion. Also, please take note na in relation to bone and mineral homeostasis, inversely proportional ulit yung relationship ng calcium tsaka phosphate ion. Okay, inversely proportional. Diba? This has something to do with the kidney response to parathyroid hormone. Na-introduce ko naman to, diba? Sa group 1A. Okay, na-introduce ko yung relationship nila na inversely proportional. Ano ba yung response ng kidney kapag na-activate yung parathyroid hormone? Diba? Pag na-activate yung parathyroid hormone, ang response ng kidney na enhance yung reabsorption ng calcium ion. Okay? Which is bababa yung phosphate ion in the body. Okay. So that is for the general properties of calcium ion. Now let us proceed to the pharmacologic action of calcium. Okay, for the therapeutic uses of calcium. So una, very important siya for blood coagulation. In fact, this is an important blood coagulation factor. So when we say therapeutic use ni calcium in relation to blood coagulation, this is very relative to clotting process. Kumbaga, yung body kasi natin, yung body natin during tissue injuries or pag may bleeding in our body, yung compensatory mechanisms ng body natin to counteract that particular bleeding is through blood coagulation or formation of clot. Okay, coagulation, yan yung formation of clot, pamumuo ng dugo. Okay, yan yung mechanism ng body natin to counteract bleeding para ma-stop yung bleeding. Now, with calcium ion, meron siyang importanteng role, significant role during clotting process, during blood coagulation process. That is why important si calcium ion during blood coagulation. Also, very important siya for muscle contraction. Ayan, muscle contraction, and for the release of neurotransmitters. Neurotransmitters, in general, these are the chemicals, endogenous chemicals that is being secreted in our body, which is very responsible, important for the transmission of signals, transmission of electrical impulses in the nervous systems. Okay, so yun yung mga neurotransmitters, and nare-release yung neurotransmitters sa mga vesicles, okay, sa mga storage areas nila in our body with the presence of calcium ion. Okay, that is why important din si calcium ion in relation to this action. And kakasabi lang natin kanina, di ba? Component ang calcium ion sa hydroxyapatite na mineral, which makes it the primary element of bones and teeth. And take note, it makes up about 99% of bones and teeth, yung calcium ion. So these are the pharmacologic action in general of calcium ion. Very important for blood coagulation, muscle contraction, release of neurotransmitter, and the primary element of bones and teeth. Now let us proceed to the cases, conditions in which yung calcium ion is insufficient or yung calcium ion is not utilized well, it is not absorbed properly in the body. Of course, if that is the case, that will result to calcium deficiency in our body. Ibig sabihin mababa. Bababa talaga yung calcium ion in the body. Okay, so again, the following conditions, again, ang problema is mababa yung calcium ion. Okay, so una we have, by the way, itong mga deficiency states na to, yung apat na to, these conditions depends on age of the patient. Okay, so una tayo sa osteoporosis. Yes, anyone can develop osteoporosis. But this condition is very common. This is most common among women after menopause. Okay, osteoporosis. I think familiar naman siguro kayo, di ba? Pag nakarinig kayo ng osteoporosis, it has something to do with the abnormality or problema sa bones. Wherein, si osteoporosis yung nangyayari, specifically, decrease daw yung bone density. Bakit decrease yung bone density? Kasi in general, nagkakaroon ng imbalances between the new bone and the old bone reabsorption. Hindi balanse yung reabsorption ng new tsaka old bone. Kung saan, ang nangyayari, mas marami pa yung nare-reabsorb na old bone. Okay? Siyempre, we suppose na pag marami yung nare-reabsorb na old bone, siyempre yung old bone, mababa na yung calcium dyan. Therefore, resulting to lack of deposits of calcium ion in the bones. Kaya nga, yung manifestation kapag may osteoporosis, yung manifestation, very fragile yung bone. Nagkakaroon ng brittling of bones. Okay, so yan yung nangyayari sa osteoporosis. So in general, yung problema talaga is mababa yung calcium ion. Okay? Osteomalacia naman in rickets. For osteomalacia, ito yung condition among adults. Rickets, ito yung for children or infants. So ito yung osteomalacia. Then, ayan. And then this one is the rickets among children. Itong dalawang condition na to, halos parehas lang yung clinical manifestations. Yung nagkaiba lang is saang age, okay, affected. O sino yung mga patients being targeted. Okay? So pag osteomalacia, adults, rickets, children. And these two conditions specifically, they are marked with severe softening, nagwi-weaken yung bones. Very weak ngayon yung bones. Okay? And that is mainly pinaka-root talaga, pinaka-root reason bakit weak, soft yung bone. Sobrang deficient yung vitamin D. Okay? Again, most often caused by this condition is vitamin D deficiency. Siyempre, kapag mababa yung vitamin D, remember, kailangan ng vitamin D para enhance yung absorption ng calcium. Siyempre, kung bababa yung vitamin D, baba na rin yung absorption ng calcium ion. That is why nabilong pa rin siya sa deficiency state ng calcium. Okay? Kahit yung pinaka main reason is mababa yung vitamin D. Kasi nga may relationship, 'di ba, si vitamin D towards that of the absorption of calcium ion in the body. And for the last deficiency state of calcium is hypocalcemia. We can actually define this based on its term. 'Di ba? Inia, it means blood or serum. Pag calci, of course, that comes from the ion calcium. Okay? Then hypo, mababa. So we can define this condition as a low blood levels of calcium. So mababa yung calcium ion sa blood. So yun yung hypocalcemia. Okay? So as illustrated, nagkakaroon ng paralysis. Okay? Paralyzed yung part ng muscles ng patient pag may hypocalcemia. Kasi nga, di ba, kakasabi lang sa slides kanina, isa sa mga pharmacological action ng calcium is very important siya for muscular contraction. Siyempre, pag bababa yung calcium ion sa blood, uh, that could really cause spasm of muscles, that could really cause paralysis later on. Okay? So taken all together, these are the deficiency states or mga conditions ng patients wherein mababa. Ang problema is mababa yung calcium ion. We have osteoporosis, osteomalacia, rickets, and hypocalcemia. So let us now proceed to the important compounds of calcium. Okay, so let us start with calcium bromide. Of course, obvious naman, may bromide ion. Okay, may bromide ion yung compound. That is why we can obviously classify this as a depressant drug or sedative. So medication for the management of hypomania or mga manic episodes. Okay, just like bipolar disorders. But again, the first line, take note, first line treatment pa rin for bipolar disorders, mania, manic episodes is still lithium carbonate. Okay, lithium carbonate. Example of a brand ng lithium carbonate is yung Kilonium. Okay. Next is the calcium carbonate. Okay, calcium carbonate, this is also known as precipitated chalk, prepared chalk. Prepared chalk is also known as dropped chalk. For prepared chalk, this is an indigenous natural form. So indigenous native form of calcium carbonate siya that is usually freed from impurities. So, ibig sabihin, gi-undergo siya og purification process. And that purification process is the so-called elutriation technique. Okay? So, purification process na siya ng calcium carbonate producing prepared chalk. And for its uses, so another ano siya, basic compound. So, it can be used as antacid. Okay? Anti-acid. And take note as an anti-acid, kapag ginamit siya as anti-acid, expect na meron siyang adverse effect na constipation. Okay? So, what particular anti-acid, aside from calcium carbonate na may constipation effect? Is it magnesium containing compounds or aluminum containing compounds? Merong constipating effect. It is aluminum. So same with aluminum containing. Same with aluminum containing compounds used as antacids. Si calcium carbonate din, merong constipating side effect when used as anti-acid. Okay, di ba yung mnemonics natin for aluminum is, for the side effect of aluminum is alatae. Alatae, so constipation. Okay. For calcium carbonate, starts with letter C. Calcium carbonate starts with letter C, so constipation yung side effect niya. Okay, when used as antacid. Example of a calcium carbonate containing antiacid, which is very common in the marketed commercially, is the Caramel S Advance. Diba, na-introduce ko naman to sa part 1 ng group 2A elements. Si Caramel S Advance, okay, meron siyang calcium carbonate. But in this case, since meron siyang kasamang another anti-acid, which is magnesium, inorganic compound na magnesium hydroxide na ka-counteract, nababalance yung side effects nila dalawa. Okay? Di ba si calcium carbonate, meron siyang constipation effect. But with the presence of magnesium carbonate, okay, napipigilan yung constipation effect. Nababalance eh. Kasi yung magnesium hydroxide, di ba, ginagawa niya diarrhea naman yung side effect niya. Okay, so balanced. Okay, so yan yung isa sa mga rationale bakit kino-combine sila to somehow balance their adverse effects or their playbacks. Okay. Then another thing about calcium carbonate when used as antiacid is that it causes rebound acidity. So acid rebound or rebound acidity. So sulat ko dito ha, same naman with sodium bicarbonate. I-scan over nyo yung notes nyo about sodium bicarbonate. Nagkakos din kasi yun ng rebound acidity. So the same with sodium bicarbonate, si calcium carbonate, nagkakos din siya ng rebound acidity. Ano nga ulit yung rebound? Hyperacidity. Diba condition yan in which yung stomach natin nagpo-produce ng even more acid. Diba? After consumption of foods, after consumption of drinks, diba? Nagpo-produce na noon of even more acids yung stomach natin. Bakit? Bakit ulit nagre-rebound? Kasi ulit, with antacids, with prolonged high doses of these antacids, ina-alter nila yung normal environment ng stomach na supposedly dapat acidic yung stomach. Siyempre, gina-neutralize man nila, okay? Tumataas na yun yung pH. Nagiging basic na yun yung environment ng stomach. Kaya the moment na nailabas na sa body natin yung mga anti-acids, na-excrete na sa body natin, syempre yung gagawin ng stomach, okay? Yung gagawin niya, rebound. Yung gagawin niya. Meron siyang may grand entrance ng mga gastrin. Okay? Kaya nagkakos ng increased acid secretion. Okay, yan yung rebound hyperacidity. So, with the use of anti-acids containing calcium carbonate, sodium bicarbonate, you really have to monitor the usage. Okay? Huwag prolonged use. Okay? Kasi nga nagkakos sila ng rebound hyperacidity. Then, other compounds other uses, okay, rather, of calcium carbonate, other uses of calcium carbonate. Merong mga calcium carbonate which is available as supplements. So yun naman, ginagamit for the prevention of osteoporosis. Okay, pwede siya. Kasi nga, di ba, yung calcium carbonate merong calcium in the compound. Ano ba yung problema sa osteoporosis? Mababa yung calcium. Okay, so pwede ma-manage yung osteoporosis with calcium carbonate containing supplement. So very good siya to supply the lacking iron. Okay. Also, we have toothpaste containing calcium carbonate. Okay, so ayan. Calcium carbonate, 35% weight by weight. Yung Colgate Sensitive Pro Relief. Okay, it contains calcium carbonate, which makes sense. Kasi nga, di ba sabi natin kanina, yung calcium is a very essential element sa bones, tsaka sa teeth. Okay, it makes up, that is the reason bakit rigid yung property ng teeth as well. Kasi nga, may calcium ion. Also, may carbonate ion, yung calcium carbonate, so pwedeng gamitin as carbonating agent, source of carbonate ion. Then we also have this so-called milk alkali syndrome, or this is also known as Burnett's syndrome. Now, this condition is caused by too much or prolonged ingestion of calcium, usually in the form of calcium carbonate, plus mga alkali compounds. Example of an alkali compound is milk, di ba? So too much prolonged ingestion of calcium, usually in the form of calcium carbonate, that can cause milk alkali syndrome. And take note, ang pinakamalalang kinokos ng condition na to, Burnet syndrome, nagkukos to ng hypercalcemia. Okay, hypercalcemia. Calcemia. Ano ba yung problema sa hypercalcemia? Sobrang hyper taas, 'di ba? Hyper mataas. Sobrang taas ng calcium ion in the blood. Now, how do we manage this condition? What do you think? Sobrang taas ng calcium ion daw. So, paano ma-manage? Siyempre, withdrawal of calcium ion, the intake of alkali compounds to manage this condition. So, withdrawal of excessive calcium ion and alkali intake. That is how to manage this condition, Burnett's syndrome. Next compound of calcium is calcium hydroxide. Okay, so calcium hydroxide, this is also known as slaked lime, hydrated lime, milk of lime. We have this so-called solution of calcium hydroxide in water. Okay, that is known as lime water or the calcium hydroxide solution. Okay, lime water, again, that is a solution of calcium hydroxide in water, lime water. For its uses, ginagamit siya before as anti-antacid, and yung gamit niya until now is saponifying agent, and also this is being added to the baby's milk formulas. Okay, this is being added, calcium hydroxide being added siya to baby's formula or milk. Para saan? To prevent the curdling of milk. Para masustain yung quality ng milk. Okay? Para hindi madaling mag-clump, diba? Mag-curdle, hindi madaling mag-solidify yung texture ng milk. That is why calcium hydroxide is being added. Okay. Next compound of calcium ion is calcium sulfate. Calcium sulfate, this is also known as gypsum. Okay, gypsum, chemically known as calcium sulfate dihydrated. Again, the dihydrated form, dihydrated form of calcium sulfate is gypsum. Okay, Now, for its uses, meron siyang pharmaceutical use during tableting processes, yung pag-manufacture ng tablets. Ginagamit siya as diluents in particular. Okay, again, it aids in tableting, which is particularly used as diluents or pag narinig niyo yung diluents, ibig sabihin yan, fillers, okay? They fill in, okay, the particular size of that tablet. Okay, so nag-a-add sila kumbaga ng bulk. This is being added to the active ingredient ng tablet to add bulkness, okay, to make a reasonable size of the tablet. Okay, yan yung uses ng diluent. So for calcium sulfate, take note, isa siyang pharmaceutical excipient when compounding tablets. Okay, ginagamit siya as diluent. And next, we also have calcium sulfates that are used as casts or as supports. Okay? Particularly, yan yung plaster of Paris. Okay? Again, yung form ng calcium sulfate that is used as casts, supports is yung hemi naman, hemi-hydrated form of calcium sulfate. Hemi meaning half moles of water. Hemi-hydrated um, form ng calcium sulfate, plaster of Paris. Yan yung ginagamit ulit in preparing bandages, in casts, support. So, ito, sa illustration, ayan, familiar man siguro mo. Okay, ginagamit siya to provide rigid support, protection during injuries, okay, or mga injured bones, mga soft tissues. Okay, so yung calcium sulfate in particular, or plaster of Paris, na ginagamit for casts or supports, isa siyang white, okay, white, heavy, super heavy white powder that forms a thick paste. Okay, so paste-like texture na madali lang mag-harden. Okay, very quick lang siya mag-harden when mixed with water. So, familiar man siguro mo. Di ba pag may nabalian, usually, gina-casting na siya. Okay, may mga cast impression. So, yan yung pop or plaster of Paris. So, yan yung isa sa mga uses ni calcium sulfate as an inorganic compound of calcium. Then, we also have calcium hypochlorite. Okay, for calcium hypochlorite, because of the hypochlorite ion, meron siyang disinfectant activity or bleaching effect. Okay, in particular, yung disinfectant property niya, ginagamit for sanitation of swimming pools. Okay, yan yung calcium hypochlorite. Then we also have calcium oxide. Calcium oxide, this is known as lime, the quicklime burnt lime. Okay, siya yung component ng Bordeaux mixture, which na-introduce ko naman. Yung Bordeaux mixture, diba? Na-introduce ko yung Bordeaux mixture uh, under sa coinage metal, sa copper, cupric sulfate. Diba? Bordeaux mixture component niya is cupric sulfate and ito, si calcium oxide. Okay. Then ingredient din yung calcium oxide in preparing Vleming solution. Vleming solution is also known as sulfurated lime solution, USP. Okay. Now, ano ba yung general uses ng dalawa? Bordeaux mixture, Vleming solution. In general, these are, diba, fungicide. Okay, mayroon silang antifungal property. Or in general, may antimicrobial property. In fact, meron nga tayong ano yan, veterinary products containing lime, containing calcium oxide, which has antimicrobial activity. Okay, so very good for um, dogs and cats. Okay, may mga bulate-bulate. Okay, ayan. So, pwede siya. Yung calcium oxide. And if you recall your notes regarding Bordeaux mixture, gun din yung explanation natin. Si Bordeaux mixture, di ba ginagamit siya as antifungal. Okay, during infestations of aphids sa mga plants. Okay, so pwede siya as antifungal. microbial. Okay, calcium oxide. And we also have calcium chloride. Calcium chloride, this is an electrolyte replenisher. Component din siya ng Ringer solution. Naalala yung solution of 3 chlorides, si Ringer solution, yung Hartmann's solution or the lactated Ringer solution. May calcium chloride component sila. Okay, so electrolyte replenisher siya. Pag mababa yung calcium ion in our fluids, in our physiological fluids, you need this kind of electrolyte replenisher containing calcium. Okay, and the rest, calcium citrate, gluconate, levolinate, and lactate, these are also electrolyte replenisher. So very good for those patients in treating calcium deficiencies. Now, in the case of calcium lactate, meron tayong mga tablets. Okay, tablet form. Okay, that is orally taken ng calcium lactate. Ganun din, ginagamit siya as supplement. Okay, very good for treating calcium deficiencies. Okay, nagsusupply siya ng lacking calcium ions in the body. Sinusupplyan niya pag may lacking calcium ion in the body. So we have Calactate na brand, or kung familiar mo sa yung Caltrate, ba yun? Caltrate Plus na brand. Okay, Caltrate Plus. Excuse me. That is also a calcium supplement. Okay? So, ayan. And for the last slide of calcium compounds, we have the dibasic calcium phosphate. Ito naman yung recommended calcium salt as electrolyte replenisher for pregnant women. Okay? So, ginagamit siya among pregnant women kapag may deficiency states ng calcium. Siya yung recommended calcium salt. And we also have tribasic calcium phosphate. Okay, antacid. The calcium phosphate. Calcium phosphate, this is also known as bone ash. Bakit siya tinawag na bone ash? Kasi literal na yung product when the hydroxyapatite is burned, it produces calcium phosphate. Okay? That's a bone ash. Okay, yung ashes ng bones, it is made up of a calcium phosphate. Then lastly, aditate calcium disodium, or the ethylene diamine acetic acid, that is used as treatment for lead poisoning. Bakit siya pwede for heavy metal na lead? Meron siyang chelating property. It forms complexes with the heavy metal lead. So, comparable yung action niya same with BAL. Naalala yung BAL? Yung British anti-Lewisite? Or yung dimercaprol. Diba? Also known as dimercaprol. Chelating agent din yun. Very good for heavy metal poisoning. Okay, so those are the important compounds of calcium. Ayan. Now let us proceed to the fourth element of group 2A, the alkaline earth metal. So we have strontium. Strontium is commonly known as brass yellow metal. Okay, this exhibits very similar properties with calcium ion. That is why later sa mga compounds ng strontium, I'll be introducing to you some compounds with activity towards fastening the rate of bone mineralization. So very good for the bones. Meron ding mga radioactive compounds ng strontium that is used for the diagnosis of bones or scanning of bones. So later slide, may introduce ko yun. Okay? That is why stated dito na may same property siya with calcium. Kasi nga, calcium is a primary element of bones. Okay? So, ayan. That is why may mga salts tayo later ng strontium. Very also good for the bone mineralization. Also, we have salts. Salts of strontium. that is used in red pyro techniques. So, yan yung mga listed salts of strontium that is used in red pyrotechnics. Ibig sabihin, ginagamit in making fireworks. That is why kapag may, kung maka-witness mo fireworks, tapos may kulay red, that is because it has salts of strontium. So, yan yung nagbibigay ng red color, brilliant, brilliant red color sa fireworks. Okay, strontium salts. And we can actually test it under in the laboratory under non-luminous flame ng Bunsen burner. We can test what is the color of these salts under the blue flame of the Bunsen burner. And yung kulay niya is crimson red. So very reflective sa kulay na pinoproduce nila under non-luminous flame. That is actually possible, no? There are not all ions can be tested under flame testing or under non-luminous flame ng Bunsen burner, but there are some. There are a few selected um, ions na nagpro-produce ng characteristic color under non-luminous flame. So isa nga doon yung salt ng strontium. And under non-luminous flame, kulay niya is crimson red. Okay? So ayan. Now let us proceed to the important compounds of strontium. Let's start with strontium chloride. Strontium chloride with the chemical formula SrCl2. Um, this is a compound of strontium that is a component of toothpaste na Sensodyne. Okay, so very important siya in the formulation of Sensodyne formulation. Not all Sensodyne formulation, but there is a particular Sensodyne formulation, yung original one, may nakasulat nga, di ba? Strontium chloride. Okay, may component siya ng strontium chloride. Very good siya to desensitize teeth. Okay? That is why, di ba, si Sensodyne, for sensitive teeth talaga siya. Okay? Clinically proven talaga siya to relieve the pain with sensitive teeth. Ayan. So, strontium chloride, ha, hindi siya anti-cardiogenic sa formulation na to ng toothpaste. Siya yung nagde-desensitize ng teeth. Okay? Tooth desensitizing agent siya. Then, meron din tayong available radioactive isotope ng strontium. Okay? B89, injection of strontium chloride under the brand name Metastron, ginagamit for the diagnostics to scan and study bone. Okay? In particular, si Metastron ginagamit for the diagnosis and treatment of osteogenesis imperfecta, or ito yung tinatawag na brittle bone disease. Brittle yung bone. With that, pwede siya ma-compare sa osteoporosis na condition, di ba? Sabi ko kanina sa osteoporosis, nagkakaroon ng brittling of bone sa osteoporosis. But yung dahilan, kanina, bakit brittle ang bone sa osteoporosis, mababa yung calcium ion. Now, for osteogenesis imperfecta, tingnan, yung term niya, may gene. Okay, gene. So, ibig sabihin, magkaiba yung causes ng osteoporosis tsaka osteogenesis imperfecta. Kasi, when we say brittle bone disease or osteogenesis imperfecta, almost lahat ng cases nito results from heritable disorder. Okay? In particular, ano yung problema? May problema sa collagen. Okay? Again, yung condition na to, there is defect in the collagen. Defective collagen, but genetically related. Okay? So again, ang reason ng condition na to, defective yung collagen, which is genetically caused. Okay? Now, kapag defective yung collagen, please take note, it could greatly affect bone mineralization. Kasi yung collagen This is very important for bone structure. Very important siya for bone grafting. Therefore, kapag may defect sa kanya, depektado na rin yung framework ng bones. That's why nagkakos ng brittling of bones kapag may osteogenesis imperfecta. So magkaiba sila with osteoporosis kasi kanina osteoporosis mababa, deficient yung calcium ion. Yan yung problema sa osteoporosis. Kaya nagbe-brittle yung bone sa osteoporosis. But with this condition, may defect sa collagen and this is genetically caused. Heritable siya na disorder. Nasa lahi. Okay? Nasa lahi. Nasa genes. Okay? So, ayan. So, may formulation tayo ng strontium, compound ng strontium, and that is strontium chloride. That is very good treatment for this kind of condition. Excuse me. Next compound of strontium is strontium bromide. Again, may bromide ion in the compound. Pwede gamitin as sedative, depressant. But again, the first line of the treatment of hypomanic disorders is still lithium carbonate. Ayan. Then we also have strontium lactate. Okay? Strontium lactate, this is particularly a compound of strontium that is used to speed up the bone mineralization. So very good siya for bones with osteoporosis. Okay, strontium lactate. This is marketed under the brand name Strontolac. Okay, so again, this is a compound of strontium used in the treatment of osteoporosis. Okay. So somehow, with this kind of uses of the compounds of strontium, relative talaga siya with the properties of calcium. Okay, kasi it has something to do with the teeth, it has something to do with the bones. Okay, so very relative to the uh, action of compounds of calcium. Okay, next is barium. Barium comes from the a word, Greek word, baris. It comes from the Greek word, sorry, baris, which means heavy. Okay? Now, the same with strontium, may mga salts din ng barium. May mga salts tayo ng barium that is used in green pyrotechniques. Okay? And in the laboratory, we can actually test under flame testing yung some of the salts of barium. And very relative din yung characteristic color na i-imply or na-produce nila under non-luminous flame. Yung kulay na na-produce nila under non-luminous flame. Okay, example, barium nitrate. Gi-flame test nimo siya under non-luminous flame of the Bunsen burner. Yung pinoproduce niya somehow is a yellowish green. You can actually search. Yellow na siya, yellow. You can actually search on the YouTube or internet flame tests of barium. Okay, flame test of barium or sa Google. Okay, yung lalabas na kulay niya is yellow-green. Okay, under blue flame ng um, Bunsen burner. Yung pinoproduce na kulay niya is yellowish green. Okay, so somehow very reflective. And also barium, it forms insoluble phosphates, insoluble sulfates, what else? Insoluble carbonates. Okay? Which are all white in color, di ba? Yung barium carbonate, for instance, kulay white siya. Okay? Then for the barium toxicity, also known as barytosis, this is a form of a pneumonia. Okay, so meaning affected is yung upper respiratory tract. This is mainly caused by excessive exposure or excessive inhalation of barium salts or mga barium fumes. Okay? And usual nga manifestation ng mga patients with chronic exposure to barium salts, clinical manifestation sa kanila is nagkakaroon ng seizure. Okay? Nagkakaroon ng seizure or convulsion. That is why, as an antidote, pwedeng gamitin yung magnesium sulfate. Kung naaalala nyo, magnesium sulfate when administered intravenously, parenterally, meron siyang anticonvulsant activity. Diba? Anticonvulsant siya. So, very good siya to manage seizures. Okay? By the way ha, with magnesium sulfate, magkaiba yung action niya if given intravenously and versus given orally. 'Di ba? Pag orally given yung magnesium compound, yung activity is diarrhea, laxative, cathartic. Okay? Cathartic or laxative. So may diarrhea na side effect. Okay? If orally given. Now let us proceed to the compounds of barium. Let's start with barium hydroxide. This is also known as barite. This is commonly used as carbon dioxide absorber. So meron na tayong all in all pang tatlo itong compound na may activity as carbon dioxide absorber. 'Di ba una kong na-introduce na carbon dioxide absorber na compound is yung lithium hydroxide. What else? Yung soda lime. The soda lime is also a carbon dioxide absorber. Then ito, pangatlo, barium hydroxide. Those are carbon dioxide absorber. Okay. Then we also have barium sulfate. This is the most important, again, most important insoluble compound of barium, which is used as a radioactive substance for gastrointestinal tract imaging. GIT is gastrointestinal tract imaging. Okay, ibig sabihin si barium sulfate dito, ginagamit siya, most frequently used siya, or siya yung pinaka best chosen na contrast medium for radiologic gastrointestinal examination. Okay, example, pag may condition yung tao with regards to its intestinal tract, then nagpa-x-ray siya ng GI tract niya, usually binibigyan muna sila ng barium meal. Siyempre, yung component ng barium meal is barium sulfate. Ano lang yan? Powder. Yung barium kasi kulay white to crystalline, white to pink. Yan yung shade niya. White to pink, ano siya, crystalline powder na ginamix with water. So, pinapainom yung patient ng barium sulfate in solution, yan yung tinatawag ng barium meal, so that pag in-undergo na ng x-ray imaging, yung colon, yung stomach, mas clear yung result. Ibig sabihin si barium sulfate dyan, pinapataas niya yung contrast. Okay? When the patient is undergoing GIT imaging. Okay? Pinapataas niya yung contrast. Okay? That's why ginagamit siya as contrast medium. Di ba? In GI examination. So very helpful siya to easily diagnose various diseases in the GI tract, in the gastrointestinal tract, in the digestive system or tract. Okay? But please take note when used as when this is used in this particular um pro, ano yan? Ginagamit siya in this way, okay, as a substance for GIT imaging. Kapag ginamit siya in that regard, in that field, it causes constipation. Okay? So, tandaan, it causes constipation to patient. Okay. We also have barium sulfate that is mixed with zinc sulfide, which is used in paint manufacturing. Okay, ginagamit siya in paint manufacturing. Ito yung lithopone. Lithopone, again, that is a white pigment. So, obvious naman kasi yung zinc sulfide, kulay white. Okay? And the salts of barium, kulay white din. Yung barium carbonate, barium sulfate, phosphate, kulay white din. So this is a white pigment used in paint manufacturing, lithopone. Then for the last compound of barium, this is used to, yung barium nitrate, that is mainly used to preserve cracking of fresco painting. Yung fresco painting, that is a type of wall painting. Okay, wall painting. Tingnan na. And usually, prior to wall painting, nilalagyan kasi yung surface ng wall or it is first coated with plasters. Okay, kaya yung nakalagay dyan, painting embedded in plasters. Okay. So, saan papasok si barium nitrate? Kapag natapos na yung wall painting, yung fresco painting, solution of barium nitrate is being sprayed on the paints. Okay? Para ma-prevent yung cracking. Very prone kasi to cracks ang mga painting when done in the wall. Okay? Pwedeng mag-crack yung painting material. Okay? So, yung barium nitrate, again, this is being sprayed sa mga paints to prevent cracking of the material. Okay? Then for the last slide, okay, last element under alkaline earth metals, we have radium. It forms one of the most soluble hydroxide salt. Ayan. Radium. Ayan. Again, radium, it forms one of the most soluble hydroxide salt. Okay, and this is a very highly radioactive element that was discovered by Miss Marie Curie. At dahil nga radiation producing yung element, it can really be extremely dangerous. So very dangerous siya sa health. However, before, okay, it was used before in many everyday products. Example, in manufacturing or uh, producing wristwatches. Okay, yung paggawa ng mga relo or in manufacturing toothpastes. Okay? Before, ginagamit siya. But, yun na nga, later on, it has found out to have adverse health effects. Okay, kaya hindi na siya ginagamit ngayon in making everyday products. Okay? So today, yung main use niya is under radiopharmaceuticals. Kasi nga, very radioactive man siya na element. So ginagamit siya for cancer radiotherapy or for diagnosis purposes.